Good afternoon, everyone, and thank you for joining us for the Pancare Foundation's Living Well series webinar, which has been made possible thanks to funding from the Dry July Foundation. My name is Kara Markovic, and I'm the new head of programs at Pancare, and I'll be your host today. We're thrilled that you're able to join us, and many of you are coming from all corners of this beautiful country, so we will start with the Welcome to Country. In the spirit of reconciliation, Pancare would like to recognize and acknowledge the traditional owners of country throughout Australia and recognize their continuing connection to the land, sea, and community. We pay respect to them and their cultures and to elders past, present, and emerging. By way of introduction, I am an integrative physiologist and scientist by training and have spent over 15 years in the medical device and diagnostics industry in Australia and globally, developing biotechnology to improve lives. I've been with Pancare going on 6 months now, and my role involves the development and delivery of Pancare's research programs, as well as its Pansupport patient and care programs and services. If you're new to Pancare, we are a not-for-profit organization whose purpose is to support people living with upper gastrointestinal cancers, their carers and families, to raise awareness and to accelerate research for these cancers. Upper gastrointestinal or upper GI cancers include pancreatic, oesophageal, gastric, biliary, and liver cancers. And since Pancare was founded a decade ago, we have raised over $11 million for research and patient and care support programs for these cancers. And our goal is to drive this even further in the immediate future and deliver better outcomes and better lives for those affected by these cancers. In fact, Pancare has released a new 5-year strategy, which clearly defines our aims and provides a framework for how we will achieve these aims. And you'll be seeing more from Pancare. And if you have a look at our website, you will see a new website at the moment, launching this week. And you'll begin to see the Pansupport name more often as well. And Pancare proudly acquired the Pansupport site last year from the University of Melbourne and has worked to incorporate the supportive care hub into Pancare's patient and care support programs. And in fact, Pansupport is the new name of Pancare's patient and care programs and services, which are personalized support services for those affected by upper GI cancers and their carers and families. So the Pansupport specialist team continues to deliver a range of services, including specialist upper GI cancer nurse consultations, support groups, one-on-one counseling, and financial assistance. And our aim is to support the physical and emotional well-being of patients and carers. And the Pansupport brand is essentially a hub for up-to-date information and educational resources. It's a network of dedicated specialist care services, and it's a safe place to connect with a supportive community with our support groups. And in our work, we are proud partners with healthcare providers caring for people impacted by these cancers. We work with GPs, oncologists, nurses, surgeons, dietitians, and importantly, in the context of today's presentation, exercise physiologists. We invest in these relationships to ensure you have the programs and the information you need to live well if you have an upper GI cancer, or if you're a healthcare professional, to provide the best care possible. No matter if you're a patient living with an upper GI cancer, caring for somebody with an upper GI cancer, or a health professional working in oncology, we hope you take some valuable information from today's session. In addition to what you'll learn, a key message that we want you to take away from today's session is that you are not alone. We're here to support you. No matter if you're recently diagnosed or undergoing treatment, or you're caring for somebody and you need to hear the voice of someone who understands, we've got a specialist support team that are here to support you on your journey. And I'll let you know more about how you can get in contact with us at the end of today's webinar. And today, to make today's session as easy as possible for you, we have a few tips on the technical side. From your viewer console on your computer or device, you'll be able to follow along with the presenter slides on the panel and view the presenter in the video. You'll also see a Q&A box or a question and answer box. down on the left-hand side. And this is where you can ask any questions for the presenters at any point, and only you will see your question. So you will be okay to ask whatever you need. Even if it's a technical issue, you can put a question into the Q&A box, and that will get through to the team behind the scenes of the webinar. Importantly, we'll do our best to answer all of your questions, but if we run out of time at the end in the Q&A session, at the end of the presentation, we'll follow up with you after the live webinar has concluded. Throughout the presentation, you will see several interactive polling slides where Dale will ask the audience several questions. And when these slides are on your screen, all you have to do is please select your answer and then click submit. And that will give the result to the collation behind the scenes. So let's get straight to today's webinar. If you have recently had surgery or are in the process of undergoing treatment for an upper GI cancer, you may be finding it challenging to keep active. You may be feeling fatigued and unsure as to which exercises are best for you. And today, we're going to take you on a guided journey of understanding the benefits of keeping active and why exercise is so important to enable you to live well. You'll be hearing from a leading exercise physiologist who has many years of experience in oncology. I'm pleased to introduce you to Dale Ischia, who is an accredited exercise physiologist and founder of Moving Beyond Cancer, an exercise physiology program dedicated to improving the lives of people with a cancer diagnosis through prescribed exercise. Dale is passionate about minimizing the side effects of cancer and cancer treatment, and to give people a sense of control over their bodies. So Dale, thank you so much for being with us today. I'll hand it over to you for your presentation.
Thank you, Cara. Thank you so much for the introduction, and thank you, Pancare, for inviting me to speak today. And if I help just one of you out there improve your quality of life through exercise, I'll be happy. So today I'm going to talk about the whys of exercise, why exercise is really important for people with an upper GI cancer diagnosis. But I'm assuming if you've tuned into this webinar, you're going to have an inkling that exercise is important for you, but we'll explore that a little bit. What are the recommendations with regards to exercise? And how you should be exercising and what needs to be considered when exercising. So I'm sitting in a room all by myself. I can't see any of you that are joining us today, but it's great that you have, so thank you very much. So we have included a few of these polls to really improve the interaction of the presentation today. So don't be shy in answering. There's no wrong questions. There's no wrong answers. And I think everyone would be interested to know the answers to the polls. So please do your best in answering them. So the first poll we have today, we're going to get straight into a poll, is about side effects. So I want you to tick what side effects you have experienced. So you can choose more than one, you can choose all of them if that is the case for you. And then don't forget to click the submit button once you have answered it. So please click on those. Oh, there we go. We've got a few people answering that. I'm going to predict that fatigue is a very common side effect. But I'm very happy to be proven wrong. So if a few more people could answer, fabulous. Thank you. Oh, in real time, I'm getting the feedback here that there's actually people out there listening. This is wonderful. That's great. So I think everyone has answered. That is fabulous. So let's look at the results of that poll. So as predicted, yes, fatigue is one of the most common side effects, as well as peripheral neuropathy, cramping, increased risk of infection. Okay, there you go. So about 69% of people are experiencing fatigue and 61% peripheral neuropathy, 30% diabetes, 30% increased risk of infection, weakened core muscles. So I'm going to discuss all these things and how exercise can help. Just another quick little poll in relation to these. So what do these side effects have in common? They suck. They can all be helped with correctly prescribed exercise. They can affect the quality of my daily life, or all of the above. So again, please select the answer that applies to you and click submit. Again, don't be shy. Oh, sorry. Everyone, whoopsie. Have I clicked it too quickly? Have I? Here we go. We're still getting some results here. All of the above, pretty much. Okay, that's wonderful. Thank you so much for contributing to that poll. So pretty much all of the above. So essentially, exercise can help with these side effects that we're talking about. So fatigue is one of the most common side effects of cancer treatment, and exercise has been shown to be the most beneficial management technique of fatigue. Cramping is also a common side effect, and stretches is one of the most effective things you can do to help cramps. Peripheral neuropathy is a very common side effect, as you are all experiencing, and exercise can certainly help improve the side effects of peripheral neuropathy, which is balance. And there's certainly some research that has undergone recently regarding a particular type of exercise, which is all about holding static balance, and that helps minimise peripheral neuropathy. But also I've found that massage can help, and with a bit of stimulation using like a spiky massage ball on either your hands or your feet. Exercise is an important component of diabetes management. And then weakened core structure, which is a common side effect, obviously, after surgery. Exercise is really important in terms of increasing your core muscles. Chemotherapy can cause some potential heart problems, so exercise can certainly help counteract that. We're going to talk a little bit about deconditioning in the next slide, and also increased risk of infection. So cancer and its treatment creates this perfect storm of deconditioning. Not only the cancer itself, but the toxicities of the drugs you're taking, previous treatments, the normal aging process. If you combined all that with bed rest and lack of physical activity, it's like this rapid aging process. So the only way of reconditioning or reversing this deconditioning or counteracting this deconditioning process is with exercise. And exercise should be a part of everyone's cancer treatment in one way or another. So I just wanted to go back to cancer-related fatigue now, as that is one of the most common side effects. It's the most limiting factor to quality of life. 40 to 80% of people experience it. It's characterised by weakness, heaviness, poor concentration, low motivation, trouble sleeping, and difficulty completing daily tasks. And it usually diminishes about a year post-treatment, but for some people it can last 5 years or more. So there's many contributing factors that we need to look at when someone is experiencing cancer-related fatigue, and making sure that nutrition is, you're taking on good nutrition, looking at anemia. So that's one time when it's self-limiting. It's a self-limiting fatigue. So if your red blood cells are low, you're anemic, it's not something you can push through, and that really needs to be addressed. But the things that I've highlighted here in orange, inflammation, depression, deconditioning, anxiety, stress, and poor sleep, can all be improved with exercise. which we believe is how it works, how exercise is such an effective management for cancer-related fatigue. So there's this fatigue cycle, which you may well be familiar with. So you're fatigued, you just want to rest. This makes you deconditioned, less fit, it's harder to move, you become less active, and then you just get more fatigued again. So it's really important to try and get your way out of this cycle, reverse this cycle. So I just wanted to show you this flyer. So this is my flyer for Moving Beyond Cancer. I was able to update this about 3 or 4 years ago, but when I initially created it, it was all about how exercise can help counteract the side effects of treatment. But now I've been able to, or about 3 or 4 years ago when the research came out, because I only wanted evidence-based statements on this flyer, that I was also able to include that exercise can improve your immune function, it can improve your tolerance to treatment, and improve the efficacy of treatment itself, which is really exciting. So just talking a little bit about immune function. So the dosage of exercise is really important in terms of improving your immune function. So the dosage meaning, you know, how much, the intensity, all that sort of thing, how much exercise. So regular moderate exercise training is the best, and that improves or increases your immune competence. But if you were to do really long, intense, prolonged bouts of exercise that is too long for you, that actually decreases your immune function. So you've got to find that perfect balance. So the overall recommendations is what I'm going to go through with regards to exercise. So now we know we definitely should be exercising, but what should we be doing? So exercise is now recommended by COSA, the governing body of cancer in Australia. It is safe and feasible across the cancer continuum, meaning from diagnosis to palliation. And it should be a part of everyone's cancer care. So the general guidelines, and I'm emphasising the general part of it, in that it may not be possible for everyone, or for some people this may seem too little, for some people this may seem too much, and I'm going to talk more about that. But basically the general guidelines is 150 minutes of cardiovascular exercise, or that's aerobic exercise, meaning walking, bike riding, swimming, and that's about 30 minutes 5 days a week at a moderate intensity. And then on top of that, it's 2 to 3 strength training sessions or resistance exercise training sessions per week, and that's of 8 different exercises using multi-joint exercises, so strengthening exercises that uses more than one joint, so push-ups rather than bicep curls, that sort of thing. And yeah, so that's the general guidelines. And I'll just talk to you a little bit about what moderate means. So moderate intensity, we can measure by a few things. We can use the talk test. So when you're exercising at a moderate intensity, you can talk, but you can't sing. We can also look at heart rate, a percentage of your heart rate, which is, you know, if you're seeing an exercise physiologist, you can work that out with them. But a really simple way of working out what your moderate intensity zone is looking at this Borg scale, a perceived rate of exertion scale. So it's a 6 to 20 scale. 6 means I'm lying on the couch, chilling out like this kitten. And 20 is I'm pushing myself so hard I'm about to pass out, call an ambulance. So the moderate intensity zone is between about a 12 to a 14, so you're working somewhat hard. And then a vigorous intensity, which is recommended in some cases for some people to exercise into that zone, is, say, a hard to very hard. So what I would like to know, we're going to do another poll. And I would like you all again to answer how you would rate your overall fitness as it was prior to your cancer diagnosis. So how you felt, how fit you felt you were prior to your diagnosis. Did you have average fitness, very, very good fitness, and don't forget to hit submit. Okay, so we've got one person answering. Oh, yep, excellent. A couple more people. Okay. Don't be shy. A few more people answering. That would be great. All right, so it's actually a pretty broad spectrum. And interestingly, they've done lots of studies. People's perception of their own fitness is usually very accurate. So if we go through this whole gamut of testing, if people rank their fitness out of a 0 to 10 scale, they end up usually being a pretty good, estimator of their own fitness, which is really interesting. So as you can see, thank you. You've all rated yourself around average. We've got a whole spectrum there. Average, very good, pretty terrible, somebody says, and very, very good. That's great. Okay, so we're not just dealing with a cancer diagnosis and lumping everyone in and you're all the same. Of course, everyone is different. Everyone's coming with their own background of situations, their own fitness level prior to their diagnosis, and all different issues. So my point is that exercise must be tailored. So we can't just go, all right, 150 minutes of cardiovascular exercise for you and 2 strength training sessions. It's got to be tailored to the individual. So how recent was your surgery? Are you currently undergoing chemotherapy? We need to work these sorts of things out. Do you have a history of a cardiac issue or a joint problem? How have you been affected by your treatment? For example, peripheral neuropathy. How bad is your fatigue? What's your balance like? Are you anemic? Do you have low immune function? Are you in any pain? What goals do you hope to achieve? Someone might just want to pick up their grandchildren. Someone might want to run a marathon. It's very different. What do you enjoy? There's no point doing exercise that you don't enjoy. It's actually really important psychological benefit just as much as a physical benefit to exercise. So you've got to be doing something that you really enjoy. And what is your previous fitness levels and also your current fitness levels? So when someone comes in for an assessment, we run through various measures to see exactly where someone is at their fitness level at that time, so we can target the exercise appropriately to get that really good immune response. But I would recommend that you incorporate all different components of fitness. So cardiovascular exercise, strength exercise, definitely core exercise if you've had surgery, balance exercise, and flexibility exercise. So we have got another poll just to keep you all awake. So since your diagnosis, I would like you to rate your fitness, your overall fitness now, on a scale of 0 to 10. So 0 being extremely poor and 10 being elite. So I'll give you a couple of seconds. Okay, you guys are all so good at filling out these surveys. Thank you so much. Okay, so seeing if I can remember, there was a lot more people in the average category. There was about 30% last time, so maybe all of those you've all dropped to below average, but some are still up in the very good and even excellent range. That's wonderful. And then a few people below. So again, everyone's different. One more poll. So who is meeting, are you meeting those exercise guidelines? Are you meeting the cardiovascular ones, 150 minutes a week, just that, just the strength sessions per week, or both? Are you meeting everything? Or you're not even close, but I'm working on it, or not even close and don't even talk to me about it? So where are you at? Okay. Remember, there's no wrong answer. It's just really interesting for us all to see where we're at. That's great. Okay, and hit submit. Okay, so as we can see, I'm so impressed. 35% of you are already meeting those strength and cardiovascular sessions per week. That's wonderful. Not even close. I'm working on it, 30%, and can't contemplate it. So everyone's in a different situation, and some are meeting the cardiovascular guidelines. So that's great. So for those of you that are not exercising yet, I want you to think about, before you start an exercise program, that you're getting enough nutrients to fuel your exercise. Are your blood levels within a safe range? So again, getting back to your, are you anemic? Are your platelet levels okay? Are your neutrophils in a good range? You may have lost some fitness. Oh, what is happening here? I can suddenly see a different screen. Why has that come up? Oh, that's disappeared. Sorry about that. So you may have lost some fitness and strength, so go easy, or better yet, get assessed by an accredited exercise physiologist such as myself, or there's many of us out there, so you can get your exercise prescription targeted to exactly where you are. And ensure you've recovered from surgery. So often you'll have your post-surgical checkup with your surgeon to give you the all clear to exercise, which is usually around the 6-week mark. And make sure your port's okay. Some people can have issues with their port when it's first inserted if you have a central port. Sometimes you need to wait about 4 weeks before you can do anything too vigorous with your upper body. And if you're getting cramps, it's really important to make sure you've got enough fluid, that all your electrolytes like your magnesium's all good, and you're doing plenty of stretching. And is your diabetes managed okay? So if you are exercising post-surgery, so immediately post-surgery, you want to move as soon as possible. So a really simple thing is just pumping your feet when you're lying in the hospital bed. Okay, we want to eliminate any possibility of DVTs. Short walks every 2 hours, for example, going to the toilet, if that's possible for you, is really great. There's usually a 2 kilogram limit, but of course speak to your surgeon about that. But know that that is only a 6-week limit, and it doesn't mean for the rest of your life you can only lift 2 kilos. That certainly can be gradually improved after that. It's very important after surgery to breathe throughout your exercise. So means eliminating that, breath holding and pushing and pushing through your abdominal wall. That's really not ideal. So it's really important to breathe and focus on your breathing when you're doing any form of exercise, especially resistance exercise. And starting with focusing on your legs, building up your muscle mass. So your legs are, contain the greatest amount of muscle mass. So work on that first, and then you gradually build up to working on your abdominals when you are ready to progress to that. And then gradually building up, increasing the load when we're talking about resistance exercise, and even cardiovascular exercise, increasing the load or intensity of that. We'll talk a little bit about that in a minute. And then exercising during chemotherapy. It's perfectly safe to do it. and it's recommended to keep active throughout chemotherapy. Of course, everyone's going to respond to chemotherapy differently, and for some people, they might feel that that is completely impossible, and you should exercise to your tolerance, but also expect fluctuations in your energy levels and what you're capable of doing. So, of course, and be guided by your own perception. So going back to that Borg scale, because when you're going through chemotherapy, it's very common for your resting heart rate and your working heart rate to both be about 10 beats higher than it usually would be. So using your heart rate as an indicator is a good idea, but also your own perception, because that will tell you also how hard you're working and if you're getting breathless and that sort of thing. And if you've got a port or a PICC line, there may be some modifications there. And watch out for balance issues. Often very an unlikely side effect of chemotherapy, or an unexpected side effect, excuse me, my lights have just gone off, I've got to wave at them, is that your balance is affected. So, if people feel like that they're bumping into walls at night and things, and that's the similar mechanism involved in your peripheral neuropathy issues can also affect your balance. And then at night when you're taking your vision away, you don't have that proprioceptive feedback. It's much harder to gain balance. So we do a lot of balance exercise prescription for people throughout chemotherapy. So just getting back to the fluctuations, and this is especially relevant if you are going through chemotherapy at the moment. Your exercise tolerance will vary from day to day, and throughout your chemotherapy cycle, people often find that they are okay on their day of chemo and up to 4 days post, and then completely crash on day 4 or 5 of their chemo cycle and then slowly come back up again. So there are good days, bad days, and absolutely forget about it days with regards to exercise, but there's certainly different exercises that you can do on a no-way day, for example, lying on your back and circling your foot in the air, or doing some gentle stretches just to keep your body moving and keep you in that routine. And doing something is better than nothing. And also, yes, very good point that I must make, that rest and recovery is just as important as the exercise itself. So most people enjoy exercising in the morning, for example, and I tell almost all my clients to have an afternoon nap, especially if you're going through chemotherapy, because you really do need to recover from the exercise session. You need to recover from your day. You need to give your body a chance to recover from what's going on. So it's just as important as exercise. So how to begin? As soon as possible. And this, now that I know how so many of you are already meeting these exercise guidelines, we can maybe talk more about the progression of this, but doing a supervised graded exercise program is great. Start low and progress slowly and gradually. So initially you start by increasing the duration. So this would be for someone who, okay, I can't manage 150 minutes of cardiovascular exercise a week, but I'm going to walk 5 minutes every second day to start with at a comfortable speed, and then increase by 20% every couple of weeks until I can achieve 30 minutes of continuous exercise every second day. Then I increase the frequency. So now I'm going to try it every day, but take that alternate day down to five minutes. So I'm doing 30 minutes every second day and 5 minutes every other, and then I'm going to gradually increase until I'm doing the 30 minutes every day. And then if you're achieving that and everything's okay, we can then gradually increase the intensity of the exercise. So gradual introduction of increasing the speed of your walking, or including hills or bike riding or things like that. And just again, a couple of points about fatigue management. So relaxation and meditation is really beneficial for a lot of people. Establishing realistic goals. something that you can actually achieve and you feel really great for achieving them. So it may be that you can walk around the block rather than thinking, right, I'm going to run 5Ks, making sure that that goal is realistic for you. Pace your day, pace your week. So try not to jam absolutely everything into one day, all your social events and everything. Make sure you're pacing yourself. Spread it out throughout the week. Exercise at the time of day when you're least fatigued. So often for most people that is mid-morning or first thing in the morning. Doing consistent and sustainable exercise is better than doing something where it's just all or nothing. So that right level of intensity for you that you can continue to do it, because consistency is key in terms of improvements. And eliminate activities that are causing you to crash. So say, playing that game of netball once a week, makes you go to bed for 2 days. Well, perhaps that's just too much. Some people really enjoy using a diary to record their exercise, fatigue response, energy levels, mood, and other things, so they can work out what's really working for them. Using music and laughter. It's great. Making sure you're eating nutritious foods that stabilize your blood sugar levels, regular sleep habits, and also laughing, getting back to that laughing point, going for a walk with a friend and having a chat is a great way of improving your energy levels. Regular sleep habits, making sure you're going to bed at the same time each day, perhaps not eating sugar or anything after 7 p.m, no caffeine, low lighting, all that sort of thing, to make sure that you get a good night's sleep. And walking in nature in the morning with the sun on your face. So I just wanted to touch on when you should stop exercising, and these are very common sense. But if you feel dizzy or faint while you're exercising, please stop. If you've got any signs of heart problems, you should probably go to your doctor or emergency department if it is severe. So shortness of breath or chest pain, irregular heartbeat, unusual swelling of your face and neck. If your blood count is low, you should perhaps not be exercising, but again, it's self-limiting. If you have a fever or an active infection, high temperature, same thing, sorry about that, or severe diarrhea or vomiting. So we are going to do a very quick test. Now I am going to need a timer actually. So this is a little bit awkward because I can't actually see you all, but we're going to do a test on your strength. So I'm going to demonstrate and then I'm going to set a timer. So I'm hoping you are all going to be able to see what I'm doing and all participate. But certainly if you have any knee pain or you're dizzy at the moment or you don't feel like you could manage this, just sit and watch for 30 seconds. But for those of you that can, please join in. So I'm just going to show you what we're going to do. It's a sit to stand test. So I'm just going to lower my screen a little bit so you can see my chair a bit better. So you're going to stand in front of a chair with your feet shoulder width apart, arms across your chest, and you bring your bottom to the chair and you stand all the way back up. And I'm going to set a timer for 30 seconds. So I want to see how many you can do in 30 seconds. So the important thing to note is that your knees are going over your toes, you're not knocking your knees, and that you're sticking your bottom out, that your back is staying nice and straight and lovely, like that. So I'm going to set a 30-second timer, and I hope this is usually where I check the technique of people, but I can't see you. So Cara, maybe you should do this so I can see you at least. See one person doing it. All right. Okay, so ready, set, go is 30 seconds. So count as loud as you like because no one else can hear you. Keep going, that's halfway. and stop. So whatever that number is, I'm just going to show you the normative data, but this normative data is for a healthy population and it only starts at age 60. So I'm sorry if anyone out there is younger than that. But the bare minimum we want for a woman who is in their 60s is to be able to do 15 of those. But that is of a healthy population, not someone that's just had surgery, not someone that's going through chemotherapy, but we just use that as a general guide to see where we're at and use it as a baseline. And then another test we do is just a stalk balance test, which I can't possibly time you, but you could time yourself. So you're just standing on one leg. I'll show you again. So you're just lifting one leg off the ground. You stand really tall, lifting one leg up, and you try and stand there for as long as you can. And that's a really nice, simple, easy balance test. And I'll just show you where you might like to be, depending upon things. So if you get over 50 seconds, that's excellent. If you get 40 to 50, good. Average is between 25 and 39 seconds. So perhaps you can do that in your own time and see where you're at. So our next poll, what would you hope to achieve by increasing your daily activity? So what are your goals? Do you hope to cope better with treatment, improve your core strength, improve your balance, reduce fatigue, improve strength and conditioning in order to cope better with daily life? So please, you can answer more than one, of course. And we'll just wait for a couple more people to answer. Again, thank you all so much for being so interactive and answering the polls. It's been great, really, really good. Okie dokie. Okay, so there's the answer to that poll. So a majority of you improve your strength and condition in order to cope better with daily life, cope better with treatment. Yep, so that's great. So I don't know where in Australia you're all coming from, but there should be an exercise physiologist near you. And in order to find one, you can go to our association, Exercise and Sports Science Australia. Go to their website and you click on Find an AEP Near Me. And you can type in cancer as a special interest, and you should be able to, and your location, obviously, and it will come up with exercise physiologists near you. There's also Medicare rebates available through an enhanced primary care plan. So under that scheme, under that Medicare scheme, cancer is considered a chronic disease. So you get a maximum of 5 rebatable sessions, and also exercise physiology is under private health insurance. So everybody should be exercising. It will help you live longer and stronger, and it's one thing that you can do for yourself to help yourself, and it has many positive side effects, including psychological, as I said before. Not only all the physical benefits, but it gives you something really positive to focus on. And it's a wonderful thing to be doing. So I'm so pleased to hear so many of you are already exercising. So thank you so much for listening. Thanks, Cara.
Expertise and the background information on the exercise physiology, the service, as well as some good tips on keeping us healthy, fit, and active, and being physically well and emotionally well, which is wonderful. Before we give we'll go through the Q&A. We have several questions actually coming in on the board. So we'll get started, because I think there are a few of them. We'll try to cap it. We've got about 10 minutes left in this session, and I've got a few pointers at the end about the Pansupport team and some upcoming events for your calendar. So we might try and keep this to about 5 or 7 minutes and see if we can get through all the questions. But if we can't get through all the questions, we will follow up with the people who asked the question after the session finishes. So don't be afraid to ask more questions. So Peter in the audience has a question. Post-surgery, he developed an inguinal hernia and now has a cracked rib from moving a coffee table. He's on chemo and wants to reestablish his physical condition. He's 75-year-old. Do you have any advice for Peter?
Wow, Peter. That is... Okay, so it's a very similar situation with an inguinal hernia. Post-surgery, you've got to be really, really careful, and it's a matter of whether you're having that hernia repaired or not. But certainly whilst it's there, you need to avoid any resistance exercise that's like a bearing down or a breath holding sort of Heimlich type maneuver. You should be doing very gradual progression, starting with really low resistance and gradually increasing it. But you can still exercise. It's a matter of how you do it, and the technique in which you do it. Yeah.
Another question which might be related to Peter's question: are there any sitting exercises or sitting type exercises that are useful in terms of stretching or sort of light weights that may not put so much pressure on the muscles that might be not able to handle them at the time, I guess?
Yeah, absolutely. There's heaps of exercises you can do sitting down. Using a TheraBand is really good. I should have brought one in the room with me, actually. I use TheraBands to prescribe exercise for people all the time. Using, like, wrapping one around your foot and doing a seated row like this is a nice exercise to do. You can hook it under the chair and do bicep curls. You can hold one like this and open out your arms to work on your upper body, doing a chest press with one wrapped around your back. A lot of upper body exercises, and then also wrapping one around the leg of a chair, for example. Plenty of exercises sitting down. It would be a great thing to do.
Oh, fabulous. Jennifer has said, thank you for the expert reminder and the info to motivate me to get back to a structured exercise program. Are there any tips that you have for motivation, maybe getting back into some exercise more from the emotional point of view? Like, how do you stay motivated to, when you're going through a tough time like chemo and you're not feeling your best, how do you stay motivated?
It's about getting into a routine, basically. So for some people, it's setting an appointment with either yourself, your friend, your dog, or your calendar to schedule it in. So, motivation gets you going, routine keeps you going. For me, I get my exercise clothes ready the night before, so the minute my feet hit the ground, I'm putting on my exercise clothes and I'm walking out the door. So there's no delay, no barrier of, not being able to find my clothes, for example, just trying to get organized. And I think, checking in with a professional is really helpful as well, and understanding the benefits, why you're doing it. Think about your goals of why you're exercising, why you want to exercise.
Oh, great. Wonderful tips and tricks there. Joyce has a question about, does chemo make it harder to recover from an injury, for example, an Achilles tendon injury?
Yes, I love this question. I have anecdotally noticed in my practice of dealing with people for many years now that tendon issues are really common with people undergoing chemotherapy. And I have asked all sorts of people to explain this to me, and it's perhaps, maybe I'll do a PhD on it in my spare time or something, but it's really, there is definitely something going on there. Chemotherapy definitely affects it. It's a bit of a blame it on the chemo scenario. I don't actually know the cellular level what's going on, but it certainly slows down and also increases the incidence, but slows down the recovery from as well. Yep, unfortunately.
Another question is about what's involved in an initial assessment from an exercise physiologist. Can you take us through that sort of initial process and perhaps why it might be really important to see an exercise physiologist at your diagnosis, or really get into the habits of having a regular appointment?
Yeah, so ideally, it would be awesome to see someone upon diagnosis, and in some situations we do see people early on, because we can get a good baseline of where they're at physically before they start treatment, and ideally trying to minimise that deconditioning process so we can sort of, if not improve their fitness, at least hold them where they're at and have that baseline data to compare to. But yeah, I've got this slide actually to show what we go through. So if someone comes to see us, this is what we go through in our initial assessment. So we talk about their cancer history, where they're at with their treatment, what their lifestyle's like. Are they active otherwise? Are they in a sedentary job? Do they work in the garden a lot? What's the side effects of their treatment? What other comorbidities do they have? So that means, any other diagnosis or heart or lung issues or joint problems, what exercise they have at the moment, and what goals they have. And then we do all these measurable outcomes. So they're basically designed to see where we're at, so we can prescribe exercises appropriately targeted at them and challenge them appropriately. So we're not aiming at too high or too low. So we look at things like blood pressure, resting heart rate, oxygen saturation, body composition. And in body composition, the main thing we're looking at there is muscle mass. Then we measure waist girth. We might measure arm if we're dealing with breast cancer, for example, and range of movement is more for breast cancer. And then we look at strength tests, so grip, sit to stand, push-up tests, balance tests, a fatigue scale, which is a factor fatigue scale. It's a questionnaire. And then we will also do cardiovascular fitness test and recovery. And then we use PhysiTrack is our exercise prescription software. So that's an online exercise software. So we design an exercise program that gets emailed. People log into it. They tick complete when they finish the exercise, so we can monitor how they're going. They talk to us through the app. They make comments about different exercises, and we can also track different outcome measures like pain or fatigue or whatever we want to track with someone. So it's really good to be accountable and sort of have that support, that online support all the time.
So just a question from the audience. Are there any downloadable exercises for beginners, or should patients be assessed first before they get some of those beginning exercise tips?
Yeah, so I mean, I am a strong believer of prescribing exercises specifically for somebody, and I know there's a lot of apps out there that everyone Joe Blow's doing sort of thing, but it doesn't take into account if someone's just had surgery or all these other things we've talked about. So I would highly recommend that someone see a professional first to make sure that they're all fine and clear to go ahead and exercise and get a proper individually prescribed program.
Okay, wonderful. And just one last question. We got just a couple of minutes left here. Exercise and peripheral neuropathy. You had mentioned some of the side effects of peripheral neuropathy, but in terms of different exercises, particularly resistance exercises with sort of light weights, is that okay for someone who has peripheral neuropathy?
So it depends how severe it is. So often there can be issues. If it is quite severe, holding on to weights, holding on to dumbbells can be dangerous, especially if they're heavy and the peripheral neuropathy is severe. So for those people, I get them to use the TheraBands, like I was talking before, with the seated exercises. So resistance bands where you can hold on. They can also be uncomfortable, actually, if you're wrapping them around your hands. So using really nice handles with your TheraBands, or wearing gloves when you're using your TheraBands is a good idea.
Okay. Wonderful. Well, we'll wrap up the question and answer session for now. There are a couple of questions that we can take offline, which would be great. And sure. I just want to run through, before I give some closing remarks, we'd love to hear from the audience your thoughts on today's webinar so we can improve our resources and services for you. So on the screen, you'll now be prompted to answer a short survey. So please take the time to provide us with your feedback, as it's really invaluable to us. And in terms of Pansupport, I just wanted to introduce you to our team. If you haven't been familiar with the Pansupport team so far, we have a Pansupport specialist team, so that if you're needing any support on your journey with an upper GI cancer, we have a range of helpful team members that can speak with you and work with you on your journey. And so while we can't provide medical advice, our team can certainly help and answer questions for you. So if we can get to the slide. Oh, you'll see your survey pop up. So if you don't mind just answering the survey there, that would be great. Shannon is our pancreatic and upper GI cancer specialist nurse, and she can help you to understand your diagnosis better, and she can provide information about treatments and their side effects or surgical procedures that you might be facing and might have questions about. Sonia is our amazing patient support manager, and she's the constant voice of reassurance to help you along your journey. Sonia can help you through a range of practical or emotional ways, such as connecting you with others, finding links to cancer and wellness services in your area, and other allied health professionals such as Dale and other exercise physiologists. Mira has joined the Pancare team as a counselor over the past few months, and she can support you through one-on-one video counseling sessions to talk you through the emotional impact of your diagnosis, or for caring for someone with cancer is having on you. And we've made these counseling sessions available free of charge to patients and carers. So Shannon, Sonia, and Mira are available for telehealth appointments, which you can book online via our website on pancare.org.au. Check it out. There's some new pages on there and new information. And you can also email the support@pancare.org.au email address. So a couple of notes for your calendar. On Thursday this week, we have our next support group is meeting this Thursday, and this is the first one for carers on their own. We are increasing the frequency of our support groups, and this one is for carers. So if you would like to join, please send an email to the support@pancare.org.au email address. And the next Living Well webinar will be on the 27th of April. And this will be focusing on emotional well-being. And so we would love for you to register for that. We'd love to see you again, which would be wonderful. So if you have any feedback beyond the Living Well series survey that's on your screen right now, please don't hesitate to contact us. If you have any ideas for future seminars or webinars or group chat topics, please let us know. We are here to help you, and you're not alone. So thank you so much again to Dale Ischia. We are so happy that she has been able to share her time and her experience and her expertise with us today. We got a lot out of it, and in future, this recording will be this session will be available as a recording on our website at some point. So if you would like to get in touch with Dale or have any more questions about the exercise physiology service, please let the Pancare team know, and we will get you in touch with Dale. Thank you very much, Dale. Appreciate your help.
Thank you. Thanks so much for having me. Bye.